So Zambia, like what has already been alluded to, HIV and AIDS is one of the priority areas that Ministry of Health is concentrating on. And we know for sure that if we don't talk about sexual and reproductive health rights, then we cannot get to work on reducing the incidence of HIV and AIDS in our country. So what Zambia has done under Ministry of Health, we've got the Adolescent Health Strategic Plan that is guiding everyone as services as being offered in our country. And we have a unit at Ministry of Health, that is the Adolescent Health Unit there. And so the way things are being done is that even at the provincial level, coming down to the districts and the facilities, we have personnel that are put in those facilities to actually make sure that the reproductive health and rights are really adhered to. As you may agree with me in this room, we know that we have rights, isn't it? As young people, we've got rights. And these are coming basically from the human rights. And we know that Zambia is also one of the countries that is also, adhering to the human rights. So when we are looking at the things that have worked well for us as Zambia, we have documents or protocols or guidelines that help us to make sure that whatever we do is enshrined in the protocols that we are doing, so that whether you're in the rural areas or you're in the urban area, the service is going to be the same. So that has really helped us, and we are working with line ministries, and we know that Ministry of Health alone cannot do it. So what we have done is that we work hand in hand with line ministries to make sure that that agenda is achieved. We've got the Ministry of Community Development, we've got the Ministry of Gender. So all those ministries or government ministries, we work hand in hand to make sure that this agenda is pushed forward. And we don't leave the young people behind. Young people are the driving force of everything that is done in this country. So all we are saying is that when we work with young people, we are able to achieve what we want to achieve. No wonder we are all here this morning. Thank you.
Thank you very much. So that was Zambia's perspective. So on a scale of 1 to 5, as Zambia, where exactly would you rate the efforts that you have put in place as the Ministry of Health to ensure that this agenda is realized?
So I would rate it at 5. There's a lot that has been put in place. The only challenge sometimes that comes is that people don't read the documents, or people don't really access the services that are being provided. I'll give you an example. We know that as young people, we've got rights, isn't it? But rights are there. You also have a responsibility. If services are being provided, there's no way that will come to you to go and access the service, isn't it? You have to get on your own, you get off from home and you go and access this. So it requires the Ministry of Health and also the recipients of that care to come together and make sure that we hold that agenda. So what I can say is that ministry has done what it can do. So we really need to work with the young people to make sure that they know their responsibility as well. Rights come with responsibilities, and together we make each other accountable for the efforts that are being put. So accountability is also very important. Thank you.
So that was the Ministry of Health from Zambia, rating their efforts a 5 out of 5. There's a different reaction that I got from the audience, but I believe we'll talk about that during the question and answer session. So let us also hear again from Zambia, representing the UNA. Let us get a different perspective when it comes to the Zambia's perspective, especially focusing on HIV and AIDS. What exactly has been done, what is working, and what still remains a challenge?
When I say ra, you say? There's no Chimwela. I'm not going to say what I'm going to say. When I say Ra, you say Ra.
Hi.
Ra.
Hi.
Thank you so much. So I'm from UNAIDS, like I earlier said, but I'm going to speak on behalf of the NAC because I was given a go-ahead by the Director General, Dr. Kibim Sokotwani. So the status of HIV in Zambia. So from the last census that was done that was in 2020, the number of people like over the country we estimated between 19 million to 20 million. And from that number, we have an approximate also, or an of people living with HIV is 1.4 million from that number, from 20 million. And from that 1.4, we have about 1.3 people on treatment. So where's the other 1 million of people who are not on treatment? From the people who've tested positive for HIV, where's the other 1 million? They are definitely in our communities, right? Yes, so, but towards the epidemic, we've really made a lot of progress. And I think most of us who remember, I know we are all around 30s and 20s, but a long time, HIV really had a face. When you were diagnosed with HIV a long time, there was no treatment, and we knew that it was a death sentence. By then, you could tell by looking, but I think by now, I don't think you can tell by looking that somebody is HIV positive. So those are some of the strides that you can see that have been made. And we have 95 targets, which is targets. No, I'm on the panel, but I would just like to engage with you people. I just want to ask in the audience, who knows what it means when we say 95, 95, 95? We have just pick one so explain. Please, in the simple way, please give the mic.
So the first 95 is at least 95 should know their status. At least 95% of those who know their status and are positive should be on treatment. The last 95 is at least 95% of those who know their statuses of those who are on treatment should have viral suppressed. Thank you very much.
Thank you very much. Well said. Thank you very much. So the status for Zambia, for the first 95 that he mentioned, where he said people who are living with HIV should know their status, we are currently at 98%. We've done well, but it would be good to reach at 99.9999, but we're doing well so far. So we're currently at 98%. Then for the second 95, where we mentioned that people who test positive should be on treatment. So for that one, then for the last 95, where people who are on ART should be virally suppressed, we are at 97%. We are doing well, but we can do better as Zambia. So that's the status of HIV. So what efforts are we doing as Zambia, the National AIDS Council, as UNAIDS Zambia, and all the people, like including MOH? I know MOH has spoken, but so what are we doing overall? So we have scaled up combination prevention. I'm sure most of you have heard that we're going to receive LAN in the country by 1st December. I think I know it will be but by 1st December that LAN will be in the country. We know that there is PrEP now. There is availability of condoms.
So it seems that quite a number of things have been done in Zambia. So I just want to find out if there's one thing that you'd actually recommend to the other country, looking at what Zambia has done. Under 30 seconds. If one thing that you'd actually recommend as a strategy that has worked for Zambia, that
prevention, it's working well. Where like for countries long-lasting PrEP, for which is injectable for 6 months, almost countries have yet. Only South Africa so far can sign, and it's going to work well. And I think the combination prevention has really worked well.
Thank you. So that was Zambia giving its perspective. Actually stated, we're able to tell that Zambia is doing massive things and actually working for Zambia, something that the other countries is also its perspective on what is working and what exactly is not working. Perhaps there's something that Zambia also can learn from Kenya.
All right. Thank you very much. I think in terms of the target, I would say in Kenya, the current population of people living with HIV in the country, I think, is about 3 to 4%, about 3.7% of to the 95, 95, 95 target. We are at 97, 97, 94. So we are still not there. In terms, yes, we've achieved the target in some of the areas, but there's still a little bit more work to be done there. So just to lay a perspective, and I do believe this is a perspective that is very common across Africa. We are dealing currently, as you said, with a generation of youth who possibly have not seen the AIDS pandemic as is. HIV as a chronic illness might not be as bad as possibly a different generation which saw a lot of people die from HIV or AIDS. In our country, there's even a joke among the youth that youth fear pregnancy more than HIV. Is that true? Yeah. So, and this essentially in terms of beefing up the comprehensive sexual education, and I was very glad when the country representative for UNAIDS here was here. We need to change in the attitude of our youth that condom use has to be consistent and correctly used. So in terms of comprehensive sexual education has been adopted in Kenya, of course with the little challenges here and there because of the religious nature. Some people feel like we're going overboard. There are various youth led in active and aware, because a lot of the HIV transmission among the youth are either poverty or finance related, where you actually have people having sex to get pads and such things. For ourselves, we're feeling that yes, you can have unprotected sex because you have access to PEP after, and PEP should be at
On a scale of 1 to 5, where exactly would you rate Kenya? On a scale of 1 to 5.
I would say, let me say a 4. A lot of effort is being done. I would leave the 1 because we are not 100% yet. And for us to have 38% of new infections coming from youth, we need to do a lot of more effort in that population.
Thank you. So a 4 sounds more reasonable, yeah? So thank you very much, Kenya. We're going to go to Zimbabwe. We want to get Zimbabwe's perspective. We've learned what Zambia is doing, we've learned what Kenya is doing, but what exactly is Zimbabwe doing? And is it working for you? Do you feel there's a lot that needs to be done? What are some of the barriers that are actually making it difficult for Zimbabwe to realize the full potential that it intends to?
Okay, thank you. So for Zimbabwe, we have an approximation of 1.3 million people who are living with HIV within the country. And we have also reached the 95 targets. And what's on the red currently is the rate of infants with HIV, where we are on 64%. But what's promising is that out of those approximation trends of 65%, 95% of those infants with HIV are, so it's actually promising. And as of what has been working, Zimbabwe has got a national HIV fund, which has been localized. We've got a tax fund, which actually is directed to HIV programming and prevention. And that's a plus for us to say, even after the withdrawal, the country has got a sustainability, a roadmap to say with local funds, how can we prioritize prevention methods that can sustain the country. What has been also working for us is that in tertiary institutions, with the support of private sector, we've got condom champions who are there to offer condoms to young people in tertiary institutions. We also have a multi-sectoral approach when it comes to HIV funding, where the private sector also bring in some funds towards HIV funding. We have been offering cabotegravir, which is PrEP in an injectable form, but this has been mainly designed for key populations, and it has been in differentiated service provision areas. We also have the CATS model, which are called the Community AIDS Treatment Support cadres, who are within the communities. They track their peers for HIV treatment refill, and also adherence monitoring when it comes to HIV prevention. And these are CATS peers. They are also working within the national structure of National AIDS Council, and they also have a sustainability roadmap to say, after being an adolescent treatment support, they transit to young mothers, young fathers who are on art, so that they keep on tracking each other. Also, what has been working well, we have a coordinated platform of young people's platforms, which is called the Young People's Network on Health and Mental Well-being, which is at community level, and they coordinate efforts that are aligned to HIV prevention and service delivery at community level. So these have been promising programs that are being done by Zimbabwe, and also the use of mHealth to enhance tracking of young people on art, and also making sure that they get service delivered at the right time.
Thank you very much. Quite a lot. Quite a lot is being done by Zimbabwe. And I just have this one particular question for Zimbabwe. Since you're representing an organization, you're not really representing the government of Zimbabwe. I want to hear from your perspective as an organization. How easy is it to ensure that you work with the Zimbabwean government to ensure that the needs of the young people in Zimbabwe are actually realized? Under 30 seconds.
You said how easy?
Yes, how easy is it to work with the government to ensure that the needs of the young people are actualized?
What I should say is that the government has promoted a meaningful platform for private sector, not only for youth advocates, but for private sector to join hands in the fight against AIDS. You would like to know that we have a current youth policy which addresses the SRH needs of young people, as well as issues to do with HIV. So that becomes a strong stepping stone for private sector to come on board and support the government.
Okay, so on a scale of 1 to 5, where are we as Zimbabwe?
I would say 4.
You would say 4.
Yes.
Okay, 4 is not bad. 4 is not bad. That's actually good. So now we're not going to move on to Senegal. We want to get Senegal's perspective on their current state. What is the current trend as far as HIV and AIDS is concerned, but also sexual reproductive health and rights? What is working in Senegal? What is not working? And what are some of the policies that are contributing to the current results that we have in Senegal?
Bonjour à toutes et à tous.
Good morning, everyone.
Morning.
Alors, l'honneur m'est permis aujourd'hui de parler au nom du Sénégal.
It's an honor for me to speak in the name of Senegal.
Et Zambie aussi est un pays de cœur, parce que je me rappelle en 2012, vous étiez champion d'Afrique et vous nous avez battu à 2-1 à Bata.
Zambia is a country's heart because mother has been here.
One, two.
D'accord. Alors, quand on parle aujourd'hui du Sénégal par rapport au VIH/SIDA et tout ce qui concerne la santé sexuelle et reproductive des adolescents,
When we speak about HIV and sexual reproductive health in Senegal,
il faut comprendre que les avancées majeures ont été notées ces 5 dernières années avec un taux de prévalence de 0,3%.
with the great strides have been made with a rate of 0.5%, prevalence rate of 0.5%.
Alors, ces avancées, on les a constatées avec une dynamique de l'État à travers sa politique et ses programmes.
This progress can be linked to the policies
and the different program that has been implemented in country.
Avec le Comité national de lutte contre le sida, donc avec un plan stratégique de lutte contre le VIH-Sida, la tuberculose et l'hépatite.
With the National Committee to Fight Against HIV, Tuberculosis, and Hepatitis C, and the national program.
Donc, intégrant maintenant une approche inclusive qui prend en compte les personnes en situation de vulnérabilité, notamment les personnes vivant en situation de handicap.
With an inclusivity clause which takes into account persons that live with handicap and who are vulnerable.
Mais axé plus maintenant sur les droits humains, c'est-à-dire les besoins des communautés en termes d'accompagnement et de prise en charge.
And it's really based on human rights in the community that needs to be accompanied in this program.
Maintenant, pour parler de ce qui a marché, il y a les cliniques mobiles qui sont déployées au niveau national.
There is, to speak about what works, is the mobile clinics that are deployed at the national level.
Mais aussi, il y a le programme des pérééducateurs, c'est-à-dire la sensibilisation par pair que les jeunes font dans les différentes localités.
And there is a peer educator program that implement activity through sensitization.
Alors, à côté de ça aussi, bien évidemment, il y a des barrières, il y a des défis aujourd'hui sur lesquels l'État du Sénégal est confronté.
But we have also challenges that the Senegalese governments are facing.
Alors, ces barrières sont plus liées juridiques et politiques.
And those challenges are more political and legal.
Notamment la criminalisation de certaines pratiques sexuelles qui sont criminalisées au Sénégal et la pénalisation aussi de l'exposition du VIH.
And also there is the criminalization of certain sexual practices.
À côté de ça aussi, il y a tout ce qui est contexte culturel, notamment la stigmatisation sociale, la peur d'être jugé et tout ça.
And also you have the social aspects, which is based on stigmatization and the fact they are feared to be judged.
On a aussi l'insuffisance de services adaptés aux besoins et aux préoccupations des jeunes qui sont plus dans le monde rural.
There is the inadequacy in the services that are given for people that live in a rural area.
Okay, so just to get one more thing from Senegal, most countries have policies that may speak to HIV and AIDS and sexual reproductive, but the implementation of those policies becomes troublesome. Is that the same experience with Senegal?
Il dit qu'au Sénégal, il y a des politiques sur la mise en œuvre des activités en lien sur les droits sexuels et reproductifs. Est-ce qu'il y a des difficultés dans ce sens?
Oui, bien évidemment, il y a des difficultés parce que, je l'ai dit tout à l'heure, il y a le tabou qui est la principale difficulté, mais l'autre aspect aussi, c'est l'accès aux services de soins qui sont liés à la santé sexuelle et reproductive des adolescents et des jeunes.
There is taboo around sexuality, but also access to sexual reproductive health.
Okay, so on a scale of 1 to 5, where is Senegal?
Sur de 1 à 5.
De 1 à 5, je dirais 3, parce qu'il y a des efforts quand même qui sont en train d'être faits.
He said 3 because there are efforts to be made.
All right, thank you very much. So that wraps up the session that we had. I think we can let us give a round of applause to the panelists. So I believe we've heard the different perspectives from the countries that are represented on this particular panel discussion. And right about now, I'm going to open it up to maybe just 3 or 4 hands. If you have any question, just 3 hands. If there's any question that you have for the panelists, but also make sure you direct it to that particular individual on the panel that you would like. So let us go to, where do we start from? Let us start with our lady there. And then we'll go to the back. And then we'll come to the front.
Yes, thank you. Concerning Zambia's report that has just been given for HIV and AIDS and SRHR relating to how it's being handled, I came with this question. I would say straight from home, like straight from where I'm coming from, where I was privileged with attending the provincial adolescent health Indaba, and it was stated to say, according to gender, it is allowed for a young person to, it's not allowed for a young person to get Jadel or these prevention measures, because it's like you're opening a way for them to go and have sex. But then according to health, it also comes to say everyone has the right to access, I want to remember the correct term. Thank you. Family planning services. Everyone has the right to get family planning services, but then we are not looking at the HIV and AIDS that's being opened, that's being paved way for. But we're now looking at family planning. But then it's a contradiction. I really need that clarity. Thank you.
All right, thank you very much.
I'm Talanini Kashinge from Zambia.
Thank you. So let us have a person from the back, because I think we mostly get
And it shouldn't be a Zambian, please.
we mostly get the people in front. So let us also go to people at the back.
Hilliard, you can take somebody not from Zambia.
Where are you from?
Any other hand? Hilliard, here. There's this gentleman, the man right in a suit. You can do gender. He's here. Which country are you from, sir? Okay.
The 11th province of Zambia. Good morning, ladies and gentlemen. I'm Clayton Arakatape from what Chairperson said, the loudest country in the region. So my question is directed to the Ministry of Health. So allow me just to take you back to the Abuja Declaration of 2001, whereby all the OAU states were gathered in Nigeria, and they agreed one thing to curb AIDS, HIV, malaria, and tuberculosis. They further agreed on one thing, to contribute, each state to contribute about 15% of its national budget so that we can curb HIV and AIDS. So now my question is, what progress is Zambia making towards the target? I thank you.
Thank you. Let us have a hand from this row.
A lady?
Side. Yes, and it should be
a lady.
So keep in mind that there are different countries represented there.
From Namibia. Do we have a lady from Namibia? Namibia has found favor.
In the eyes of the chair.
In the eyes of the chair. Where's the hand?
Okay, hello everyone. This question is directly.
No, let her greet us nicely. She's made a mistake somewhere.
Okay, when I say hi.
No, greeting her.
Hi. All right. My question is going directly to the Ministry of Health in Zambia. As I was listening, I heard the one representing the Ministry of Health saying that they are able, they 95, 95. They are now at 98, 97, something like that I heard. So the people, it means that also includes the people that are on art. So I wanted to get a clarification on, especially on young people, the adolescent girls, young women and boys that are on art. How is the ministry able to control them to keep taking their medication so their viral load is suppressed for them to meet that 95, 95? Because that is a problem in each and every country.
All right, thank you. So we actually said we're taking 3 hands. We're taking 3 hands. There's still more hands. Am I allowed to take one more?
No.
All right.
Unless if you want to go to tea at 1 o'clock. No, we need to move. There are more sessions that are coming. So,
all right, so if you have any other question, you can actually see the panelists later on. As we're having tea, you can interact. So at this point, let us actually listen to the question, the answers that the Ministry of Health and Zambia has.
Thank you very much for those questions. I'll start with the first question, which was talking about family planning, services, and the HIV that it seems like we are contradicting, even when we know that a person has got the right to access the contraception or contraceptives in a facility as a young person. So how I would answer this one is that we are not contradicting. When it comes to young people, even as they come to access services, information on HIV is given. And the methods that are provided to the young people, we explain to them that they can choose whatever method they want. For example, if one chooses to use an injectable or an implant, we'll explain further to say that cannot, prevent HIV and STIs. So in short, what I'm saying is that during the provision of services to these young people, HIV and pregnancy prevention, they go together. We'll give you a method, and we also need to give you a method that will protect you from HIV as well. For example, the condoms. If you choose a pill, you need to go on a condom as well. If for example, you choose maybe a contraceptive and you say, no, I want to use PrEP, you can go on PrEP, but be rest assured that you need a condom because PrEP will not prevent STIs. So this goes together. We are not contradicting. I think for further information, when you visit our adolescent health spaces, you are going to be able to find full information on that one. I hope that is answered. The second one, the question was talking about the Abuja agreement that was made to say it was agreed that 15% of of every nation's budget should be put on towards HIV services. And what progress has Zambia made on this one? I think Zambia has done quite a lot. When you look at most of our services or our activities in the health institutions, you are going to find that HIV, like I earlier explained, is a priority for Zambia. When we come to the young people, you will see that we train them. We train them as peer educators so that they can have full and accurate information on how they are going to protect themselves from HIV and AIDS. And this requires money. Training requires money. We train them, and this is a policy that is there in the adolescent health strategy. We have a minimum platform or a minimum standard that each health facility has to have. For example, in each facility, we require that at least we have a minimum of 8 peer educators that are trained with accurate information to go out there and impact positively on their friends. We also have healthcare workers that are trained so that they become adolescent sensitive, so that they are able to offer the services that are required. That requires money. And when you look at even just the curative services that are there, most of it is also helping to reduce on the HIV. So in short, I would simply say Zambia has made a lot of progress towards this agreement. The last part, we are talking about the young people that those that are in ART or on ARVs. How do we help them to continue taking their drugs so that they have viral suppression? Remember, I think the young people in here, they know that, there's that slogan that we're doing, or there's this saying that we're saying that undetectable equals what? Undetectable equals what? Okay, so this is what we've been working on, especially with the young people, because we know that when the viral load is suppressed, we are going to have few new infections. So a lot is being done. We have in our facilities, we have support groups for those that have HIV, where they can come discuss their issues, what problems are they having in terms of medication, and solutions are found at that level. we also meet with the caregivers to discuss on what they can do to make sure that they improve on how these adolescents are taking their treatment. And a lot is being done.
A lot is being done. That is why
Thank you.
actually she mentioned that Zambia has actually done a lot, such that when it comes to rating it out of 5, she put it at 5. It simply means Zambia has done quite a number of things. And so if you would like to learn more about what Zambia is doing, you can actually see the representative from the Ministry of Health, as we're having tea and actually interact with every other representative representing different countries on this particular panel discussion. At this point in time, I'm going to allow the panelists to please take seats as the audience gives them a round of applause. You can do better than that. You can do better than that. You can do better than that. Thank you very much.
Alrighty. Have all the questions been answered? Have all the questions been answered? Are we hungry? Okay, that's obvious. So what we're going to do now is we are going to have our tea break. That what we're going to be doing is we're going to be going in groups to avoid congestion that side. Okay? So I'll ask our leaders this side to go and have their snacks. When they come back, if they're interacting from here, then we can have another bunch. So when they are back, this bunch goes. Okay? This bunch goes, and when these ones come back, we'll be doing it in half like that. Is that okay? Omakula kumbwe banzi yaba neba. Aquaskin, eh?
All right.
Okay, we'll do it as simple as that. So
yeah, but also another announcement come with the Ministry of Health from national provision. May you please go to the exhibition booth at the TYP booth. There is something that you guys need to do there. All of the guys. And then also there is a QR code for the photos for the day, all the pictures that you guys are having. I'm not sure it's supposed to be beaming, but I'm not sure. QR code outside, just scan it so that you can have pictures. So may our panelists and esteemed guests, and then also, I don't know, your instruction, you say this group first?
So when they come back, they are going to have their tea. When they come back, then this group can go.
All right, so whilst you're waiting to have tea, or maybe for other groups to come, all the reflections, that you have to say now about what you've done so far.
It's what?
Good morning, everyone. My name is Professor. Okay, I think it's a chance to speak from the first panel, which was talking about consent in sex. So I just wanted to comment and maybe acknowledge a program that was going on in Zimbabwe. I don't know about other countries, which is called No Means No. It's our duty as peer educators to empower the girls to say no and be straightforward with their no. Not like I don't know. No. If you want to say no, say no. If you want to say yes, say yes. And then for the